Hello, welcome back. This is Adam Rosen. You're listening to the Total Knee Tips and Pearls podcast. This is the 99th episode, so thanks for tuning in. And if you're new to the podcast, please subscribe so you'll get updated of all of the latest and greatest episodes that are coming your way. So, just some housekeeping stuff, the list of what I have coming up, just to kind of give you a little teaser and also to kind of keep me on track to get these produced and out to you. I have one episode that I'm still working on to capture some data, and I'm going to give you my 2 cents on all the different total knee implants. I've talked about this before, but I haven't completed it yet just because the more I dive into it, there's a lot of little numbers that I want to have for you when we talk about that. I also have been pulling a bunch of articles and statistics, and I'm trying to compile all that to talk about suicide, and specifically physician suicide, just because, unfortunately, we're in a profession where the number is higher than we would like to see it, and it's only increased over the past few years with COVID. So I do want to talk about that and just your health and wellness. I do have a plan to sit down with one of my partners, Dr. Jeff Wilde, and pick his brain on the direct anterior. As you know, I'm a big knee person. I've done less and less hips as I've progressed in my career. I enjoy knees. I find them more interesting and complicated. As I get older too, I also find my back is not as healthy as it once was. And it's a lot more strenuous for me doing hips now than doing knees. But always being a posterior guy, I'm going to pick his brain because he's gone through the process of on table to off table. And what's also interesting for all of you osteopathic orthopedic surgeons that are tuning in, we have our spring meeting coming up in Carlsbad. So luckily for me, it's just a drive up the road. I don't have to travel. And I was actually asked to lecture on 2 topics, one on social media. So you guys are all here listening to this, and we'll talk about Twitter and Instagram. But also I was asked, we're doing a kind of point counterpoint. And one of my previous fellows, Dr. Phil Huang, is going to be doing why he does anterior. And I was chosen by the moderator, Dr. Steven Sizer, who's at Rothman, who's also one of our previous fellows and also a graduate of my residency, also PCOM, who's moderating. He asked me to do always posterior. And then lastly, I'm pulling some stuff to talk about same-day discharge total joints and go over things that I would look for, when I think it's safe, when I think it's not safe. So that's what you have coming up, probably in the next, that's the next 2 months. But today what I want to talk to you about is something interesting. I've heard about it before. I've looked into it. It's something that I've talked to some of my patients about, and I'm thinking more and more about making it more of a standard, and that is the idea of essential amino acid supplementation. And it was interesting because I remember hearing about this first a few years back, and this was 2020. The Ranawat Award from the Knee Society was given out to a bunch of investigators for their paper that they published in the Bone and Joint Journal back in 2020, and it was entitled Perioperative Essential Amino Acid Supplementation Suppresses Rectus Femoris Muscle Atrophy and Accelerates Early Functional Recovery Following Total Knee Arthroplasty. And this was a really interesting article, and I remember reading about it and had picked and chosen which patients I thought might be candidates for it based on what I found. But when I was thinking about discussing this, I just did a literature search, and what was interesting is I found a very similar, almost identical article that was published out of the University of Oregon and the Slocum Center for Orthopedics in 2013 in the Journal of Clinical Investigations, and that was entitled Essential Amino Acid Supplementation in Patients Following Total Knee Arthroplasty. So here's 2 good articles, both basically showing the same thing. So the article in 2013, and I just look online, you can read through the details, but basically, again, fairly well done study, double-blind, placebo-controlled, randomized clinical trial. They'd enrolled a bunch, but had some dropout, so they wound up with 28 individuals, and average age was 70 in the placebo group and 68 in the essential amino acids group, so pretty similar there. And what they did is they randomized them to 2 groups. There was the group that would take 20 grams of essential amino acids, or the other group, which was given placebo, and these were taken twice daily between the meals. They started this a week prior to surgery, and they continued it for 2 weeks after surgery. And they took measurements at baseline 2 weeks and 6 weeks. And they did this with an MRI, and they were looking at thigh musculature, and they were also looking at strength and functional mobility. And what was interesting is that when they looked at the group at 2 weeks, the change from baseline was almost 4 times worse in the placebo group. And then at 6 weeks, it was almost 3 times worse, the placebo group, when compared to the control group with the essential amino acids. And they also found that the group that received the amino acids performed better at 2 weeks and 6 weeks with functional mobility testing. And they found that their changes in the quadriceps muscle atrophy was associated with this functional range of motion. So their conclusion was that the essential amino acid treatment attenuated this muscle atrophy and accelerated the return of functional mobility in their patients that were undergoing total knee replacements. I was interested in, a couple things, because obviously, you're looking at, age of the patients. So these are definitely around your average to slightly older than average total knee replacement age when you look around our country. They did have tourniquet times. So the average tourniquet times were 42 and 43 minutes. For both groups. I didn't find in their article specifically their protocol, so whether or not the tourniquet was up for the entire case or selected cases, or did they let it down at the end of the case. But at least it looks as if it was similar, because there's also the discussion now about how the tourniquet plays into muscle strength, atrophy, quad function, and it seems like we're in another phase where a lot of people are starting to try to go tourniquet-less. So that might be another way that your patients might improve. Now, the more recent article, the one in the Bone and Joint Journal that came out, was very, very similar. So again, this was a double-blind, randomized controlled trial, 60 patients broken into 2 groups of 30, and their essential amino acid was a little bit less. So instead of the 20 grams twice daily, what these patients took is just 9 grams once daily, and then versus the placebo. And they looked at the rectus with ultrasound, and they had checked this again baseline. So they did 1 month before surgery, 1, 2, 3, and 4 weeks postoperatively. They also looked at pain, and they also looked at albumin. And what they found at the end was that all changes were statistically significant as far as the changes in less atrophy, less loss of albumin, and better pain scores in both groups. So they again noted in their conclusion that perioperative essential amino acid supplementation prevents femoris muscle atrophy and accelerates early functional recovery. And I'll put both of those references in the show notes. So I just thought this was an interesting paper that if you weren't aware of these papers or familiar with these papers, it is a nice adjunct that you have, because, like, for example, I just had a patient recently who showed up to my clinic with horrible knee arthritis, but he had significantly worse quad strength and weakness, almost bordering on a very subtle extensor lag, than you would expect for a guy of his size and age. And my fear is that you take someone who is already weak and you put them through an operation where we know we cause atrophy and weakness, and it makes that person's recovery significantly worse. Now, I also sent him for a workup for spine, and even after he was found to have some stenosis with no significant impingement, physiatry also noted that there was something a little off. They actually even referred him to neurology that did EMG testing and just found, mild peripheral neuropathy. So other people were seeing that this was out of the ordinary. And did an epidural, symptoms improved a little bit. I put him on a home exercise program, and he came back to see me just recently, and he had significantly better quad strength, and said, although he's still in pain, that his pain was definitely improved, and he was really interested now is, hey, am I a candidate for knee replacement? I said, yes. We've ruled out some structural problem. We've improved your strength and mobility, but this is a person that, in my practice for the past couple of years, I've said, you know what? Hey, I'm seeing weakness and atrophy now. You may have trouble. Let's talk about essential amino acids. So for right now, I'm selective in patients that I see that are weak, or ones that I think may have more issues with postoperative strength and range of motion and functional ability. And I'll recommend this as an option to them. Now, the next question that you're going to get when you recommend anything, patients are going to ask, but where should I go, or what kind should I use? Therapy, where should I go? Medications, what should I take? Supplements, what brand should I use? So I've looked into a few of these, and I don't know the best answer. But the two companies for this particular product that I do recommend to my patients, one is called Thorne, Thorne, and the other one is Pure Encapsulations. So if you do recommend these to patients and patients ask, looking at their products, they tend to be, at least from what I can read up on their companies, all their products are clean and tested, a lot of them free of allergens for patients that have different allergies. So it's a big company that they do the testing to at least give you some satisfaction that there's a purity level that the patients are actually going to get what they are expecting to get without any potential contaminants. So there it is, my 2 cents on essential amino acid supplementation for total knee replacement based on these two studies, one from 2013 and one more recently from 2020, which did win the Ranawat Award from the Knee Society, and just something that you should think about and look for, when you're pre-oping these patients and seeing these patients in clinic. Preferably preoperatively, but maybe if you're dealing with a patient postoperatively that's struggling with gaining their quad strength back, this may be something that you could add to their armamentarium to hopefully improve their function and their strength. So thanks again for listening. Until next time, I'm Adam Rosen. You've been tuning in to the Total Knee Tips and Pearls podcast. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.